Hello everyone, welcome back to my YouTube channel. Today we are going to talk about temporal bone. And here you can see at the side the diagrammatic or schematic representation of skull, and the blue color bone at the side you can see is the temporal bone. Now let's start our topic with introduction of temporal bone. Temporal bone is one of the most important bone in human skull located at the lateral sides of cranium. It plays a crucial role in protecting the brain, housing sensory organs related to hearing and balance, and form a part of skull structure. Each human has two temporal bones, one on each side of head, making them pair bones that articulate with several other cranial structures. Now let's talk about structure and location of this temporal bone. Temporal bone is positioned on the lower sides of the skull, forming parts of cranial base and the lateral walls of skull. The temporal bone consists of several regions, each with specific anatomical and functional importance. It has squamous part that forms a thin, flat portion of the temporal bone and contributes to the lateral wall of skull. It has tympanic part that houses structures of external ear, including the external auditory meatus. It has petrous part that is a dense portion that contains cochlea and semicircular canal essential for hearing and balance. And it has mastoid part that includes the mastoid process which serves as an attachment site for neck muscle. Now let's talk about articulation of temporal bone. It articulates with the parietal bone, as here you can see in the diagram. It articulates with occipital bone posteriorly, and it articulates with the sphenoid bone anteriorly, and it also articulates with the mandible at the temporomandibular joint. And all of these articulations you can see in the diagram. It also articulates with the zygomatic bone and contributes these connections or these articulations contribute to the head stability and movements. Now let's talk about anatomical features of temporal bone. The temporal bone has several distinct anatomical landmarks that contribute to its functions. The first is external auditory meatus, that is the opening that allows sound waves to enter the ear canal. Next feature it has is the mastoid process, that is a bony prominence that provides attachment point for muscle involved in head movements. Next feature is zygomatic process, that is part of cheekbone structure that connects the temporal bone to the zygomatic bone. Next feature is styloid process, that is a thin elongated projection serving as an attachment site for muscles related to swallowing and speech. Next feature is petrous part, that is the hardest part of skull that houses the inner ear structure responsible for hearing and balance. And next, mandibular fossa, that is a depression where the lower jawbone articulates with the temporal bone and thus enable movements of the jaw. Now let's talk about the functions of temporal bone. Temporal bone serves multiple essential functions in human anatomy. The first function is brain protection, as it shields important regions of the brain, including the temporal lobes. Second function is hearing and balance, that as it houses the cochlea, that is for hearing, and semicircular canal, that is for balance. Next function is head and neck muscle attachment, as it provides structural support for muscle involved in movement. Next function is jaw movement, as it forms part of temporomandibular joint that allows chewing and speaking. Next function is facial structure contribution, as it connects with the cheekbone and aids in head contour formation. Now let's talk about the clinical significance of temporal bone. Temporal bone is critical in medical diagnostics, trauma assessment, and surgical procedures. Fractures in this region can lead to complications such as hearing loss, facial nerve damage, and balance disorders. Conditions like mastoiditis and infection affecting the mastoid process require medical intervention. Additionally, disorders related to temporomandibular joint often involve the temporal bone, affecting jaw movement and causing pain. Surgical procedures involving the temporal bone may include cochlear implant surgeries, cranial base surgeries, and treatment for chronic ear infection, demonstrating its significance in otology and neurology. Now let's talk about its conclusion of all this lecture video. Temporal bone is essential structure in skull, contributing to cranial protection, sensory function, jaw movement, and overall facial stability. Its unique features, connection, and clinical relevance make it a vital study area in anatomy and medical studies. Understanding its anatomy is crucial for healthcare professionals, especially in neurology, otolaryngology, and craniofacial surgeries. And it was all about temporal bone. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.